You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have a great guest today from all the way from Central America, Dr. David Rothwell. How are you, Doc?
I'm doing great. Having a cold snap here and expecting some snow tomorrow. We don't get a lot of it here. It's usually ice and sleet here in Oklahoma.
Yeah,
Doing great. I appreciate you having me on. It's very nice to meet you.
sure, absolutely. I want to start this over with a very simple question, and people, can elaborate on that. What do you think success means to you, and what is your why in general?
Great questions. So success to me, I'll kind of share what I've shared with my kids for many years as they've grown up and now young adults, is to look at it in three different parts. One is so many people look at success as money, and all I shared with my kids is what's enough, and that number is different for different people. Some of the happiest people I know don't make much money according to the general public, and they're just happy. They're content with what they have. The other thing I encourage as success is doing something that you love and you're passionate about, because I believe if you're doing something that you're passionate about, you're going to have a bigger impact in whatever that field is. And then finally, the thing I share with my kids on a regular basis is do something that helps you have a positive impact for others, whether directly through the work that you're doing. As physicians, we've been able to enjoy having a very positive impact for other people. It's very direct, and but also maybe something that you do gives you the free time or have the resources to be able to help others as well. So those are the three things to me that really help define success for an individual, and those are have different meanings for different people. My why is to help have a positive impact in the world. When I leave and when I'm finished doing whatever I do, I'd like for people to say he was able to make a difference in my life or my family's life. And again, that can mean different things, whether it be financially or through making a proper diagnosis at the right time, or with something I'm working with a partner here in Oklahoma City on, and helping eliminate out-of-pocket costs for patients, and helping them to reallocate those resources to other parts of their lives.
Yeah, very interesting. So let's see, can you give us like a small overview about how did you start in medicine? What was your journey like, and where are you now?
So I'm a second generation physician. My father's a primary care physician, and I grew up watching him and watching the great impact he's had on the community here in Oklahoma City. And I've always had a passion for science. I'm certainly a nerd in that regard. And just combining all of those things with my why, felt like medicine was absolutely the only direction to go. I made that decision when I was in ninth grade. I wanted to be a physician, and really just kind of launched down that path since then. And it's been an amazing journey. I've been in practice for it's my 25th year in practice now. I started in 2000, and I've done a wide variety of things during that time, from outpatient primary care clinics to inpatient medicine to covering emergency rooms and critical access need locations, to a startup that will aim to help stabilize employer costs for health benefit plans, and create a direct primary care type model for specialists and surgeons in outpatient facilities.
That's awesome. So let's talk a little bit more about this kind of model, because I've had a lot of guests recently that are thinking about changing healthcare, and we all know that things are not working well, and there's so many things that we need to change. But it's a mammoth of a change that we need, a lot of time and a lot of people and a lot of like mindset change, I would say, in healthcare. What can you do now to change something in healthcare?
And I think that's a great approach to it. Change something, do something positive. Because when you look at healthcare on the whole, there's no one individual, you, me, the smartest people that we know. There's no one individual or group that's going to change everything in healthcare. I agree with you completely. You have to look at a facet of healthcare that's broken, and there's plenty of places to go with that, and try to impact, have a positive impact in that particular area, but it is way too large to do that. I think one of the approaches that really has helped me through this process of saying, okay, what can I do to have a positive impact, is to say, what is the current paradigm? Because I think the only meaningful change that's going to happen in healthcare on the whole and in different segments within healthcare is to change the paradigm. I see a lot of people, within the current paradigm trying to make some changes, and they're piecemeal changes that are not going to be sustainable. I describe it as rearranging deck chairs on the Titanic. You're really just not going to have any long-term meaningful impact. And so by changing that paradigm and doing something different, and there's so many great people out there doing it. Dr. Keith Smith here in Oklahoma City, Started Surgery Center of Oklahoma, and FMMA, which has been had an incredible impact on saying, well, let's push back against insurance, which is necessary, but let's push back and say, you don't need to control everything. There's a lot of really smart people that can have a positive impact without insurance being involved in that process. And that's direct medical care, which I really believe is the future of healthcare. It's just, there's some pretty strong headwinds there.
Well, I know you touched in a subject that's very sensitive. When I think about insurance, and I think of touching the fire, everybody's pushing back. It's a monster of a problems
It is.
and issues with healthcare, and this direct patient care model that you're talking about. It's something very new, especially for patients. And we all know that nowadays any company or any service company goes on a subscription model, right? To sustain their service and to survive. Can this be applied in healthcare?
It can, and it is. So I use direct primary care as a model, and direct primary care has been the simplest part of that equation. If you look at what primary care provides, and as a primary care physician, I'm a board certified family medicine physician, and I've done outpatient for a long time. If you look at the things that we have to bill for insurance, it's just really like taking your car to AutoZone. To get new windshield wipers, you pay for a small portion of it. They bill your car insurance company for the rest. If you haven't met your deductible, you can see where I'm going with that. It makes no sense. And in the primary care level, that is really what a lot of these DPC groups and physicians are doing a great job at, is saying you don't need insurance transactionally for primary care. These costs are predictable. These costs are small. We're not talking about a cabbage. We're not talking about acute stroke situation, transplant. We're not talking about those expensive items that insurance was truly created for. It was never created to cover everything. It was created to cover big ticket costs. And so direct primary care has figured that out. I started in that model many years ago. I did concierge medicine for a while, realized that really doesn't solve the problem except for a very small percentage of people that can afford it. And so DPC is naturally evolved from that point. So what my partner and I have done with Laconic Health's name of our company is we've said, let's take that same model of DPC and take that to specialists and surgeons and outpatient facilities. And our model has allowed for a set cost to cover 75% of your outpatient ambulatory surgical type needs. So we cover everything from cardiology. The group that we're working with wants to cover heart catheterizations, outpatient MRIs, CT, shoulder, knee scopes and surgeries, general surgery, urology. We can cover a whole host of things on a predictable monthly cost that we're talking to brokers and companies now, not the BUCAs, but the smaller companies and the brokers that are delivering products to bolt this onto their product and as a set cost. So if we go to an employer, we can say, here's a set cost for all these things that your employees are going to get. And it's very accurately determined. We have a proprietary way of approaching how do we figure out what we're going to pay these specialists and surgeons and outpatient facilities. And they're real excited for us to get this going in 2025.
Yeah, that's a great idea. But you are actually acting like a smaller insurance company, correct? That is providing a set amount per month, let's say as a subscription model to the patient services, and you're paying the providers, correct?
We pay the providers directly. So in this case, we don't go to employers directly. We partner with small insurance entities, brokers, benefit design companies, and they look at adding our product into an insurance vehicle. And so we cover a certain number of things, but again, not the very expensive, high cost portions of Medicare, where this partners naturally with DPC. We have a group here in Oklahoma City, Primary Health Partners, that's a large group in Oklahoma that's wanting to have products that include our network. The difference is that there's no claim created. It's a flow through. So we're able to partner with providers and physicians. As a doctor myself, these are doctors that I use, that my family has used, I refer friends to. These are great providers, in my opinion, that I trust. And we're a flow through entity. They get paid directly. So there's no claims. There's no adjudication. There's no copay. There's no deductible. Everything is covered under this number. And so it makes it a very clean process for the patients. It's not insurance in the sense of there's not the complexity that insurance has created for transactions within healthcare. We're trying to simplify that. We pay our providers a certain percentage of Medicare is how we determine these numbers. There is risk involved, yes. So in a sense, our providers and us are partnering to help assure that these things get covered. But we would rather take the risk, and the providers would rather take the risk than offload that risk to the insurance company, which is only shown to increase cost of healthcare and create a lot of headaches and hassles unnecessarily.
Yeah, of course, and probably push back on your model too, because that's, you're their competition at some point.
Yes, and we're
So
not a
how do
blip
you
on the
how do you
radar for
deal
the
with
business.
that? I mean, you're fighting with the mammoth of a company. Any insurance company is big enough to resist any kind of change. So how do you approach this?
So our goal is to work with innovative plan design, benefit plan design companies. A good example on an insurance company is an insurance company called Taro Health, Taro Health. They're based out of Maine. It's a direct primary care based model that they're doing. Jeff Wan is one of the co-founders, great guy, super smart, and they're doing a fantastic job at designing an insurance plan whose premium is similar to your BUCA plans, but they have DPC built within it. So there's not an additional bolt-on cost for the DPC. Now, all these patients come onto their plan have a great source of primary care, which has been shown to decrease ER visits, decrease urgent care visits, improve longevity. There's a lot of benefits to having a great primary care source. And so they're doing a great job, very interested in what we're doing. It's complex, wrapping our product into a fully insured product, but we're excited to continue that conversation.
Yeah. So one of the challenges, I guess, is for patients to know about this. How do you market those products to the patients, like to the market? Like, how do I
Yeah.
know as a patient of those kind of products, or options to, let's say, the Blues insurances?
Yeah, our marketing budget's going to be a little bit less than Blue Cross probably. So we 10 years ago, about 12 years ago, actually, my partner and I had this concept. We had several hundred patients signed up. But it was really just kind of a one-off type situation. Our goal, what we felt at that time, was we really need to have employers look at doing this for their employees. The problem was there were no really, at least here in Oklahoma and Central America, there weren't a lot of innovative plan designs going on at that point in time. Your brokers were working for the BUCAs. Everybody seemed to be relatively happy, not really noticing there's a tidal wave coming with increased costs, et cetera. And so we fast forward to now, and what we realize is our client, who we're marketing to, isn't necessarily the patient or employee directly. It's the companies that are trying to do good things for their employers. You have two different types of brokers, really. You have the brokers that are taking their fiduciary responsibility for their employer very seriously and doing everything they can to cut back on costs. And then you have the brokers that are just showing up saying, here's your three plan options. We had a 15% increase this year on premium cost. And it's something that everybody's struggling with. And so we don't really want to work with the brokers that just want to work with the BUCAs and say, here's your options, take one, they get the commission, and they wait till next year to show up. We want to work with plan design companies that are saying, we want to try to do something innovative for our employers and their employees. And so through them, we will market however they feel is best, to say, here's a plan that's unique and that it has this network called Iconic Health, it's a narrow network, but it's a network that allows for no out-of-pocket cost, no copays, no deductibles. There's no co-insurance attached to it unless they want to design it as such. But this allows for streamlined access to care. My expectation for the providers in our network is that they're going to be providing streamlined access to care. This isn't we can get them in 2 months. My providers are saying we'll get them in 1 to 2 weeks and get to work on what the problem is, see about getting it fixed, whether it's outpatient treatment, surgical, whatever.
Yeah, very interesting. Well, let's go back a little bit into your personal approach from becoming, a medical entrepreneur, from a medical clinician. What do you think the most important skill or habit you need to have to make this transition?
I used to think it was just having really good ideas, but that's never enough. A lot of people have really good ideas. I think the most important skill is to be able to develop a plan to implement that idea and surround yourself with the right people to be successful, whether that's directly or indirectly. My partner's name's Ed Bertles. He's not a clinician, but he's been in healthcare for 30 years, incredibly smart, and we complement each other very well. And so I think that's another, not skill necessarily, but another factor in being successful moving forward. But I think another skill is just you have to be pretty hard-headed. You have to be pretty focused, and you need to be very committed to whatever that plan is that you have.
Well, yeah, obviously it's success in this field is rare and it's very important. But to get there, we need to usually have a lot of failures along the way, a lot of bumps in the road, and a lot of setbacks. And we tend to learn better from those things than from success. Can you give us an example of things that so far didn't really work out for you and
Absolutely.
pushed you forward a little, a lot more than normal?
Absolutely. So I'm going to go back to the prior company. So we did try this about 12 years ago, and several errors that were made at that point in time. Now, I will say one success in that when we had that model in place was we only had to adjust the per member per month cost for radiology, even though we had calculated some pent up demand for that PMPM. We only had to adjust that one. Everything else, the providers were very, very happy with. And we went on for about a year. Why did we fail, though, is the bigger question. What happened? Well, one is we didn't really identify who our customer is. I mean, who are we a customer to? Who are we going to pursue in regards to landing that business? Well, it wasn't the employers directly. It was going to be the companies that were, or the brokers that were providing the service and the healthcare benefit plan options to the companies. And so that was one mistake. Two, we expanded too quickly. I found myself all over the state of Oklahoma trying to pick up primary care physicians because in that model, we weren't just doing specialty surgical and outpatient facility. We were also doing DPC. And so we had people in Lawton and people in Tulsa. Those are locations not close to Oklahoma City or Central Oklahoma saying, hey, come here. We want to also be a part of this. And so we were spread out too much at that point in time. And finally, really from a marketing and sales standpoint, I learned a lot about that part of the process on overspending for marketing and not having the right salespeople in place that understood our product and understood what we were trying to accomplish. As well as they needed to. And so fast forward to now, those errors and mistakes have really helped my partner and I to understand, okay, we're going to stay in Central Oklahoma because of the services that are provided within our network. We have a pretty wide radius, up to about 150, 200 miles. But I'm not going to be going to Tulsa to set up a network anytime soon. Certainly not going out of the state of Oklahoma. Our model right now is Central Oklahoma, and we will be focusing on brokers who work with employers in Central Oklahoma. And once we get that successfully up and going, working out the kinks, there are always some kinks, we will then look to expand to other locations and bring this opportunity to anywhere that's amenable to it.
Yeah, sometimes growing slower, you go farther.
I agree.
Why going from clinical practice to a entrepreneur model and a business startup?
I can impact more people by doing this than I can just seeing patients one at a time. And I've seen, I think I calculated at some point in time, 70 or 80,000 patients since I started into practice in a variety of capacities, post-acute care, outpatient primary care, emergency room. I've done it in a variety of ways, but 70 or 80,000 patient visits. And I'm grateful for every one of them because it's taught me so much about how to be a better doctor. I still love taking care of patients, so I still work at a couple of critical access need hospitals in Oklahoma where I cover inpatient and emergency room. And I'm working with a hospital team here out of Oklahoma City to work with them on some post-acute care type issues that every hospital is trying to focus on and improve. So I still get some patient care. I'm in that place where starting up a company, I've got to pay the bills on one side, seeing patients, which I do, but I'm doing things there that I'm passionate about and I enjoy and I love. But I'm very hopeful that this is successful for many reasons, not the least of which is to really help out-of-pocket costs for patients and employees and help some employers that are just so frustrated with their ever-increasing costs and premiums and how to deal with that. Say, hey, listen, you don't have to be big to go self-insured. You can go partially self-funded even if you want to not take that big step, and have some great people that we're partnering with here to accomplish that. But I'm in that transitional period where I still do clinical work and I'm still a doctor in that capacity, but I'm also taking my time. I'm my partner for 3 hours this morning to get this off the ground.
Yeah, obviously you need to spend a lot of your own time to get this off the ground, and um, something that really changes, I would think, the whole dynamic of financially for patients, because I don't know if many people know, but the first cause of bankruptcy in the United States is medical bills.
Yes, sir. It sure
And
is. It's
and
sad.
that's a tragedy. That's a tragedy that needs to change somehow. And I think companies like yours especially can help change the mindset, not only for patients who think, oh, I don't need to get an insurance from my employer, that I need to pay a copay and a co-insurance and a premium to an insurance company, and at the end of the whole thing I end up with outstanding bills that can bankrupt me. um, Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. Something as a subscription model is definitely something to think about. But also, I want to get into the fact that you, as a doctor, both practicing doctor and an entrepreneur, has to deal with financial, planning, I would say, and strategies towards your retirement. So personally, how do you see yourself going through retirement and into retirement? If you don't want to practice, if you're burned out, you have a clinical practice and you also have a business right now. Um, is there any strategy that you yourself employ to help you financially, and something that you maybe advise someone to do?
I've talked to a lot of younger people who want to go to medical school. Friends of my kids who are young adults now, and in that college phase of their life, college age phase, I should say, of their life. I've talked to plenty of medical students, residents, and young physicians as well. And what I find is there's one common denominator is really most, from what I found, everyone going through medical school and residency now, in whatever field they choose to go into, are doing it for the right reasons. It's altruistic. They want to help people. It's not about money. This generation coming up it's not about the money so much. That's there, but they really want to do it for the right reasons. And I tell young people, they're like, "Well, I want to be a doctor to make a lot of money." I said, "Then don't be a doctor. Don't go to medical school. That's the wrong reason. You're gonna hate it. You will." I said, there's other ways to make money where you won't hate what you're doing every day. But from my standpoint, just through life at a place where I'm working on setting money aside for retirement, of course. I'm 53, healthy, thank God, and enjoy what I'm doing all the way around. There are aspects of what I do that I do feel burned out with patient care, and that's not all the patient's fault. There's a small percentage that can be challenging to deal with as a physician, of course. But the system really has created this adversarial relationship, I feel like, between practitioners and their patients in so many ways, and really setting us up for failure in spite of what we're trying to accomplish, helping the patients get better, making the proper diagnosis, et cetera. And so I'm going to keep seeing patients right now. I enjoy it. I've been able to scale back a little bit, but I do aim to make this a successful venture, not for myself, not just for my partner, but because I believe in it. I believe that it's a small part of healthcare. You were talking at the beginning, healthcare is big. We can't change all of it at once. You're right. So this is my small contribution to helping try to fix healthcare and create something that pushes the insurance back to the periphery, more where they belong. I had a year ago, I fractured my back skiing, and not a fun experience. Don't recommend it for anyone. It was a Lafront T7 fracture. You know what that is and how serious that can be. And had surgery, and I had great care in Colorado where I was, and it was expensive. It was about $350,000 when it was all said and done for the cost of doing a T410 fusion. And so thank God I recovered, but I bring that up to say that's what insurance was created for. That's what insurance is created for. It started in Dallas with Blue Cross back in the 30s or 40s with teachers who couldn't afford being in the hospital. They said, we'll create a model to help you with those big expenses. And now insurance has become something where every dollar has to pass through them from a transactional standpoint, and it makes no sense. So all we're trying to do is say, we're going to push you back to the more significant issues, the more inpatient and critical care and ER and et cetera. And we're going to take these predictable portions and cost of healthcare, and we'll take that responsibility on. And because we can make it simple. We don't have to adjudicate claims. We don't have to reprice claims. We don't have to make it complex. We're just taking this. We're taking our network that we've set up from a relational standpoint, and we're just saying we're going to pass through. Here's your PM that you make. Just take good care of patients, and everybody wins. And they're ecstatic about it. I tell them it's the easiest money that they'll make. Because I'm not telling primary care physicians to refer. I'm not telling them when they have surgery, you're an anesthesiologist. I would never come into your OR and say, I think you should give this medicine versus that medicine. You know what you're doing. It's what you're trained to do. You know a heck of a lot better than I do what to do. So we are not looking for control in that regard. We're looking for take good care of patients, and our KPIs that will follow will help us to measure that success.
Changing insurance one direct patient care model at a time.
Exactly.
I wish a lot more people would think about this kind of model and start doing this in their own states, because that's how you change a system. You change it from the base up, not the other way around. With what you learned and what you know and your experience right now, what kind of advice would you give yourself when you started?
When I started being a doctor, or
when I started this enterprise?
When I started this enterprise, I think the advice I would give myself is to be more aggressive in finding partners to work with on this. Again, doesn't mean directly equity type partners or anything, but just I've been able to develop a network of people that I trust, that understand the industry. But that's we started this about 2.5 years ago, just slowly talking about it, revisiting it, talking about where did we make mistakes a long time ago. Let's not do that again. But if I had some advice myself from 2.5 years ago, it would be to be a little more aggressive in trying to find the right partners within the industry that understand insurance. Again, that's what we're fighting against, but it's also what we're partnering with. So it's a little bit of a give and take type relationship there.
What about funding?
So funding is where we are right now. We're finishing up all the materials that we need to present to the right partners. And the way I look at funding is not just who has money and wants to write us a check. We are really looking for a funding partner who understands the industry, who has a passion in some way for what we're doing. If they're here in Oklahoma, there's a lot of funding for oil and gas ventures, right? And those guys have deep pockets, but they may not understand health insurance very well. They may not understand healthcare very well outside of being a consumer, and not necessarily the right partner. Yeah, they can write a check, and help run a business from that standpoint. Certainly want all the advice we can get there. I'm really hoping that we can partner with the right person that understands the industry, can help us collaborate through this process and be an active investor in what we're doing.
What kind of projects do you have this year? Where do you want to take this? What excites you?
2025 is our year to get this out into the market, so to speak, working with our different partners, brokers that have a lot of interest in what we're doing. We're finalizing all the contracts here in the first quarter with our network. We have half of that done. We have a few more hoops to jump through there. And then from there, we can start packaging plans that we can present to employers that would include, as one option, our network. And we're excited about that. This year is about staying focused on Central Oklahoma and getting our network up and running. We are not looking to cover everything at this level. We don't cover rheumatology. We're not covering dermatology, but we will be listening to our partners and insurance entities. We'll be listening to the employers and employees as to what can we add. Our goal long-term over 3 to 5 years is going to be to have a complete package that includes everything that patients need from a specialty surgical outpatient facility at this level, and it's on a PMPM basis. And we're very confident we can do that with our model. But for this year, it's about getting off the ground. It's about getting lives on board, working out the kinks, and taking good care of people.
David, how can somebody get in touch with you and learn more about your model and eventually maybe, join you or do something similar with you?
They're welcome to reach out to me through LinkedIn, as you did, and I really appreciate. Just want to say it's great to meet you. I'm so grateful for the opportunity to be on here with you, and certainly can reach out to me through LinkedIn. I'm pretty easy to find there, or they can email me at rothwellmd@laconichealth.com.
Thank you very much for coming over.
All right, thank you. Have a good evening.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Franku. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.